Joints are anywhere a bone meets another bone or more bones. They are usually considered movable, but not always so. There are two ways to classify joints: a functional classification and a structural classification. The functional classification is somewhat restrictive, so it is not used very much. We will briefly go over the terms and spend more time on the structural classification. Functional classification includes three categories: synarthrosis, amphiarthrosis, diarthrosis. Synarthroses are non-movable joints that don't permit the articulating bones to move against each other. Example includes the suture joints of the skull. Syn means without, so without movement. Amphiarthroses are joints that permit a small degree of movement, such as the intervertebral joints between the vertebrae. Diarthroses are freely movable joints, such as knee, elbow, wrist, shoulder, jaw. However, these classifications are not used very frequently. You're more likely to come across the structural classifications. There are three here as well, but also some subcategories. Fibrous joints are joints that are held together by fibrous connective tissue. They permit a very small degree of movement. They include sutures, syndesmoses, and gonfoses. Sutures have a very thin layer of fibers joining the bones together, the sutures of the skull. We can see here, there's a tiny bit of wiggle room here. More movement is permitted when we are born because of the soft spots or fontanelles that exist. The sutures are not completely formed at this point, and this allows the head to compress and fit through the birth canal. It also allows for rapid growth of the brain during the first 6 months of life. Syndesmoses are broader sheets of fibrous connective tissue that join two bones together. This permits a little bit more wiggle room. Examples include the interosseous membrane that holds the radius and ulna together. The tibia and fibula of the leg are held together in a similar way. Gonfoses are very limited. This indicates just the teeth in the alveoli or the sockets. Here, a little bit of fibrous connective tissue solidifies the connection between tooth and mandible or maxilla. Cartilaginous joints are joined by cartilage. Pretty straightforward. Here, a small degree of movement is permitted. Synchondroses are joined together by hyaline cartilage and can either be temporary or permanent. Temporary synchondroses include the epiphyseal plate between epiphysis and diaphysis of growing bones. We might not think of this as a joint, but a joint is anywhere bones contact each other, and here at the epiphyseal plate, the bone of the epiphysis contacts the bone of the diaphysis, and these structures are held together by this hyaline cartilage. This is temporary because the epiphyseal plate shrinks and then disappears as we age. A same same situation arises with the bones of the pelvis, where the ischium, the ilium, the pubis are first 3 separate bones that then fuse together to form the os coxa or coxal bones. But when they are separate bones, they are united by hyaline cartilage. A symphysis is also cartilaginous, but fibrocartilage is found within it. Pubic symphysis, holding the 2 pubic bones of the coxal bones together in the pelvic girdle, or the fibrocartilaginous pads that make up the intervertebral discs, would also be considered this type of joint. The third type is the synovial joint, and this is likely what most people imagine when they hear the term joint. This is bones that are joined by a joint cavity, which is created by a membrane called the joint capsule. These articulating bones often do not fit together very well, which permits a wide range of motion. So these are freely movable joints. The areas where the bones come into contact will be covered by articular cartilage, a thin layer of hyaline cartilage to cushion movement and to smooth friction. The joint capsule is a connective tissue membrane. The outer layer is fibrous, with fibrous connective tissue that is continuous with the periosteum of the bone. The inner, thinner layer is composed of connective tissue cells that secrete a lubricating, viscous fluid called synovial fluid, which is the consistency of egg whites. This synovial fluid is going to coat all the structures within the capsule and allow the structures to move together with a minimal amount of friction. Other accessory structures may also be present, like the cushioning bursa or cartilaginous lips called labrum, which extend the contact between the articulating bones, or menisci, fibrocartilaginous pads that cushion movement. So some of these synovial joints can get pretty complex, and that's because of the degree of movement allowed. These joints have to walk a very fine line between allowing for this movement, but still providing stability. So this is where we can see lots of injury, like the knee is a very complex joint, quite freely movable, but it supports a lot of weight. Almost all of our body weight comes down on that knee, and that's why we see a lot of injuries there to the structures, the bursa, the menisci, the ligaments that hold that joint together. Most of the joints of the appendicular skeleton are synovial joints, and there are various types like hinge joints, condyloid joints, ball and socket joints that are separated by the amount of movement, the range of motion that is permitted at the joint. Our most freely movable joints are the hip joint and shoulder joint. These are ball and socket joints that allow a very wide range of motion. Some types of movement we'll see at these synovial joints include flexion and extension. Flexion is bending to decrease the angle between two bones. Extension is the opposite, a straightening to increase the angle. Abduction and adduction, where the reference point is usually the midline of the body. Abduction is abducting a structure away from the midline, like a person is abducted or taken away. Adduction adds it back, movement towards the midline. Pronation and supination refer to just the forearms. You might remember prone and supine to refer to the whole body. And let's take a minute to remember what those terms mean. Prone is face down. Supine is face up. So here, pronation is a rotation of the forearm so the palm faces down. Supination is the opposite, so the palms face up. Rotation refers to movement of a body part along its own long axis. For example, shaking your head no. And finally, circumduction is a circular movement of a structure, so the joint moves 360 degrees. It's a combination movement with some extension and flexion, some abduction and adduction thrown in. And here are some examples where we see flexion and extension. Here, more common example is the arms, right? Flexing is that typical bicep curl type movement. Extension is moving it back out. Abduction and adduction, again, they usually refer to the midline, so moving a leg away from the body and then back, for example. But here it's just example of the fingers shown with the middle finger as the reference point. However, the limbs can move this way as well. Then here we have pronation, supination, rotation, and then this circumduction is moving either the hand or the foot in a circle. So that's only possible at our very freely movable joints, or most freely movable. Lastly, the skeletal system changes as we age. It changes through our whole life, right? Depending on our activities and our calcium levels. Like the integumentary system, the skeletal system slows down. So bone tissue is going to slow down in terms of collagen production. In this respect, it's the same as the skin, where we saw fibroblasts slow down and produce less collagen and elastic fibers. The same thing happens here in the bones. Remember, this is the chief organic component of bone tissue. This will cause bones to become more brittle and less flexible, increasing the chance of fracture. Mineralization also decreases, resulting in a loss of bone density. Our bone mass peaks at around age 30, and then from there on out, it decreases slowly. This is especially noticeable or prevalent in women, because women have smaller bones to begin with, and then also the hormonal changes during menopause, where estrogen decreases. Estrogen has a protective function against bone loss. When that disappears, we see bone loss accelerate. And then Caucasians and Asians also experience less dense bones. Loss of bone density also contributes to an increased chance of fracture, but also causes deformities of bones, causes compression, resulting in loss of height. So when grandma starts drinking, it's not just in your imagination, it does happen. It can cause pain and stiffness, and also tooth loss. Our joints change. The cartilage elements of joints are quite breakable, and when they break, we can't repair them because cartilage is avascular. So we have a really hard time supplying that tissue with the nutrition and oxygen that's necessary for rebuilding it. This can lead to pain and stiffness, and also arthritis, which is an inflammatory degeneration of the joints. There are some types of arthritis that are unrelated to age, like psoriatic arthritis or rheumatoid arthritis. These are autoimmune diseases that you can get at any point in your life. But osteoarthritis is tied to age as the cartilage of your joints starts to break down. And because we move through our joints, this breakdown can lead to a loss of range of motion at our synovial joints. As all these problems start to occur, it becomes harder to move around, and it's tempting to become less physically active. But this just compounds the problem. So we become even less flexible. Our joints become less capable of movement, and our bone density decreases as well. To combat the effects of aging, increased physical activity, particularly weight-bearing exercises, are helpful, and consuming adequate amounts of calcium and vitamin D, as vitamin D is necessary for absorbing that dietary calcium. This can prevent or even reverse bone loss. And with adequate diet and activity, our bones can remain quite functional until old age. Calcium and vitamin D are nutrients to watch out for because these are quite commonly deficient from the diet in the United States. So sometimes multivitamin or a supplement can be very helpful.